But the first one I have listed is Dr. Joseph Kontra, Chief of Infectious Diseases for Penn Medicine, Lancaster General Health. Doctor, thank you.
Good afternoon, everybody. My task this morning is to provide an update on how the regional hospitals are dealing with preparations for coronavirus for COVID-19. Epidemic preparedness is not something that happens only when there are epidemics happening. This is something that's a perennial process, and any of our emergency managers up here can vouch for that. We've been looking at preparing for COVID-19 ever since the first cases were reported out of China at the end of January of last year. Specifically, we're looking at the epidemiology of this. Have been in preparation modes. We have seen epidemics before. Remember, we prepared for SARS and we prepared for Ebola, neither of which really hit this area. We did, however, also prepare for H1N1 back in 2009, and that did hit the area. And we got through it, we survived it, and we learned a lot from that epidemic preparedness. And it's worth recalling a couple of statistics from H1N1. Remember that about 57 million people were infected with H1N1 in 2009 into 2010. There were 237,000 hospitalizations and about 12,000 deaths. So that was a big toll. Numbers like that could be coming on the tail of the coronavirus outbreak. That's what we're trying to prepare for. So the regional hospitals have been taking a look at this. We've been preparing our physician's office, our frontline providers, our emergency departments, our urgent care centers, and our inpatient facilities for the arrival of COVID-19 patients. We've been trying to make sure that we have not only adequate staffing and staffing contingency planning, but also adequate supplies, gloves, gowns, masks, ventilators. Everything we have has become a precious commodity, and we're trying to really develop plans for how we're going to utilize those and how we're going to address the needs of our patients while at the same time protecting the health of our healthcare workers. So we meet regularly, and actually at this point almost continuously, to try and prepare. We're in touch with the CDC, the Department of Health, and also our Penn and other affiliated university hospitals around the county. The first pillar that we're trying to deal with is to keep people out of the healthcare system. Remember that about 85% of patients with COVID-19 will not require hospitalization. They can be managed at home and will do well. It's focusing on the 15% that will require hospitalization and the much smaller percentage that will require intensive care or ventilator support. How do we get ready for those? How do we plan for the surge of patients that may come at some point? And that's really been the focus of our preparedness. In keeping people out of the hospital, it's important that patients who are ill stay home. If you feel like you need to contact your family physician, that's the first place to start. We also have call centers set up to try and answer questions from the public. And the idea is to move to a scenario where we can provide outpatient testing facilities now that testing has become both commercially available and is ramping up in terms of capacity. And again, many patients can be cared for at home, and by preventing them from entering into the healthcare system, we can then protect other patients, especially those that are more vulnerable, as well as our healthcare providers. The second pillar is to limit spread once within the institution, and we have plans in place to sequester COVID-19 patients to a certain floor in our facility and to maintain their care with a specific highly trained healthcare staff. And finally, we want to make sure that we are managing our supply chain. Supplies are drying up. You've all heard that. Masks are very hard to come by. And all the supplies that we need, from gowns and gloves, goggles, everything is in short supply. So by establishing protocols to deal with this influx of patients that we're anticipating, all those things have to be taken into consideration. So one of the things that is most concerning about this particular epidemic, remember for H1N1, it played out really over about 9 months. And for COVID-19, we have about a 2-month time frame where we've gone from 0 to 127,000 approximately cases. We don't have a drug, we don't have a vaccine, so we have to rely on good old-fashioned public health. And that's where a lot of these recommendations are coming from. The idea behind social distancing, canceling large events like this one, getting people to maintain good personal hygiene, staying home when you're sick, avoiding those who are ill, all focuses on distancing patients from one another. We can stop the spread of this virus by not allowing the virus to find the next host. And that's what a lot of these social distancing maneuvers are aimed at. That's very important at this point, and although there's been some criticism of canceling large events, I think that is really the way to go at this point. We don't have cases in Lancaster County, but we will. I think that's inevitable, and I think when it gets here, we need to be prepared, and that's what we're about. Thank you.
Thank you. Next up, we have Dr. David Kasparek, Vice President and Regional Medical Director with WellSpan Medical Group.
Good afternoon. So my task today is to talk about the worried well, which really applies to probably most of us in this room. The worried well are people under 60 years old who really don't have any underlying medical conditions. These people are getting up, going to work, taking your kids to school, maybe going to the gym, going to your place of worship. And what's on our mind is, what can we do to help keep the transmission rate of this virus as low as possible? So a couple things to keep in mind as we go through this is a couple things we do know. One, coronavirus is easily transmitted. We know that based on what we've seen so far. And that two, the worried well, the people under 60 without any underlying issues, are generally at low risk of having complications from the coronavirus. Two very important things to remember. So some key things we can do to help decrease the transmission rate. Some of this has already been said, and I apologize, but we really want to hammer this message home. The first is washing your hands frequently, not just before eating or after using the restroom, maybe every hour. Warm soap and water for at least 20 seconds. And again, avoid touching your face. It's hard to do, especially sitting at this table trying to not touch your face in front of all of you. It's a hard habit to break. When coughing, yes, into the corner of your elbow, but also try and use a tissue. And then after you cough or sneeze, throw that tissue away. Don't stuff it in your pocket or stuff it up your sweater sleeve like my second grade teacher used to do. In general, avoid being around sick people. So if you don't need to be in a nursing home or you don't need to visit a hospital, don't. If you're at a place of worship and there's a group around you that seems sick, coughing and sneezing, move to another spot in the facility. And on the flip side, if you are sick and having symptoms, stay home. Don't go to work. Don't attend events. People will understand. If and when you start to develop symptoms, fever, cough, shortness of breath, the instinct is to go seek care, to go to an urgent care, to go to walk-in hours at your family doctor. As Dr. Kontra said, we're encouraging people to pick up the phone and have that conversation over the phone first. We're trying to encourage patients to be triaged first so that we can help identify which location is the best site of care to treat the patient and to determine if treatment is necessary. And then the last point in general, eat a healthy diet, get adequate rest, exercise. These are things we should be doing anyway, but they're vitally important when we're trying to maintain healthy immune systems. As far as at work every day, what we can be doing, the big one is avoid shaking hands. I saw it when I walked in, people doing the elbow bump. We're also encouraging the wave. I work for WellSpan. We call it the WellSpan wave. It's a little awkward, but again, to decrease the risk of spread. At work, keeping your keyboard clean, disinfected. Anything else you touch on your desk, disinfect a couple times during the day. If you go to the gym, make sure you're wiping down equipment after every use. You might want to ask the staff at the gym what's in the purple solution that you spray on the thing. If they can't answer that, you can bring your own disinfecting wipes with you. And when you're out shopping, bring wipes with you, wipe down the cart before you start shopping. The last point I wanted to talk about was the stockpiling of items. A lot of you have seen this in the news with stockpiling the water and the toilet paper. Really unnecessary at this point. It's been mentioned a few times that we should be following the CDC recommendations. At this time, they're recommending having 3 days of food and water on hand just in case. And then in general, it's a good idea to have about 30 days supply of your routine medications on hand at home. And again, to try and avoid wearing surgical masks whenever possible. One big effort that all the health systems are facing right now is conserving the equipment that we're going to need as this virus continues to spread. So please try and avoid using the surgical masks. The key in all this is, again, trying to stay calm. As has been said, we have no confirmed cases in Lancaster County to date. Just remember that health systems collaborating with government, schools, and other organizations are working hard to keep all of us safe. Thank you.
Thank you, Doctor. And our next briefer is Dr. Craig Skurczynski, Vice President, Emergency Medicine with UPMC. Doctor.
Thank you. Good afternoon, everyone. A lot of what I'm going to talk about you've just heard. You're hearing the same thing over and over. Repetition in this setting is probably a good thing to emphasize the importance of what we're talking about here. So I'm going to mention briefly some of the risk characteristics that go into the high risk versus low risk, and then what do you do when you actually have symptoms. So what we have found with the COVID-19 is that folks that are over 60 or who have underlying medical conditions, this could be diabetes, heart disease, chronic lung disease, are at higher risk and therefore should take more precise precautions. All the things that have already been talked about regarding hand hygiene, avoiding large groups. In addition, they need to be hypervigilant about travel. We want to stay away from airplanes. I don't think anybody's getting on cruise ships anytime soon, but the recommendation is to stay away from cruises. The folks who are at higher risk need to take some of these precautions even more serious than everyone else. All the things you've heard about already. Clean and disinfect regularly, cover your mouth when you sneeze. I'm not going to go through each of them, but all the things that have been mentioned already are important to remember for the high-risk group. So the next question that comes up is, okay, I have symptoms. What is the right thing to do? And again, my colleagues have mentioned this already. A significant majority of folks who get this virus are going to have very mild to low to no symptoms. It's important that they can stay home. Access your health care by phone. Call your primary care. Some of you have insurance providers who have hotlines. It's important to call them first. For folks who are at low risk, who have a low fever or mild cough and respiratory symptoms, going to an ER or going to an urgent care is not the best first course of action. What we're going to see is technology is going to play a role in this. Telehealth is going to play more and more of a role. A number of healthcare systems and health insurance providers will offer a visit with your provider via your phone or via a computer, and that's going to become more and more available and actually cheap, and sometimes the prices or the fees for that are being waived. So we encourage you to make contact with your healthcare providers or your insurance providers first. Next, if you need to access an emergency department, if you have some of the high-risk characteristics, or if you develop a high fever, severe difficulty breathing, you need to have confidence that our emergency departments are prepared for this. As was mentioned before, emergency preparedness does not start with one particular infectious disease. We've been through this before with a number of others, and so the emergency departments are ready. We have staff who is trained, who have the ability to use the right precautions, personal protection equipment, and to put the patients into the right level of isolation that is necessary while testing and treatment is performed. So what I want to say in closing is, again, calm, reiterate all the things that people have been saying, stay home if you can, avoid the spread. When you come, if you do have symptoms and you come to the emergency department, you can have confidence in the care that you're being given, in the care that your family members are being given, and to continue to pay attention to the CDC and the Department of Health websites for the information, all the great county-wide information that's been given here, and that's about it. Thank you.